Hi, my name is AJ Gordon. I'm a nurse at Baptist Hospital doing a physical assessment on Miss T here for Pensacola State College. Um, I have gotten verbally consent from Miss T here to have this on YouTube for class. Is that correct?
That's correct.
Thank you. All right, here's my badge and my name, my ID. All right, so the date is February 22nd of 2021. This is my patient, Miss T. She's a 25-year-old female, occupation of a waiter. She complains of lower back pain, of sharp back pain, of a scale of 4 that does not radiate. Her general survey of the patient appears to be, as stated, age, level of consciousness is alert and oriented, times 4. Skin color is consistent and appropriate for her, which is Caucasian. Nutritional status is healthy. Her position and posture is normal. Um, Obvious physical deformities with freckles throughout her whole body. Mobility and gait is normal. Her facial expression is happy. Mood and effect is also happy. Speech and pattern consistent appropriate with her native language, which is English, which is appropriate. Hearing is appropriate, and personal hygiene is also appropriate. Vital signs were taken right before this video. Her stated weight is 109 pounds. Her height is 5'1", stated. Her body mass index came out to be 20.59. Using the Snellen eye chart, she scored 20 of 20. Radial pulse rate was 79. Respirations were at a 16. Blood pressure was taken on her right arm sitting, and that came out to be 123 over 72. Temperature of 97.9. Pain assessment run done, and she scored a 4, stated. So, I'll be coming into the room, knock, knock, knock. Patient privacy, hand hygiene, and gloves. Hello, Miss T. My name is AJ. I'll be your nurse for the day doing a physical assessment. Is that okay?
That's okay.
Awesome. Can I please get your name, or can you please tell me your name and date of birth?
Miss T, October 7th, 1995.
Awesome. Now I'll be starting a physical assessment. Starting with her head, consistent throughout it looks like. I have my pen light here. Hair looks healthy and full. You can look up for me. Notice her skin looks consistent throughout. Nothing noted, no blemishes or bruises of any sort or scrapes of any kind. Looking at her face, same as her skin, consistent and normal throughout. I'm going to be looking at her eyes using an otoscope. Or excuse me. Looking at her ears using an otoscope. Good. Great. All right. I'll be using my pen light to assess her eyes. Light coming, if you could look straight for me. Great. Pupils are reactant to light. Her sclera is white and normal. I'll be looking at her nose next. Great. Do you have any congestion today?
A little bit.
A little bit of congestion noted. I'm going to be looking at her mouth as well. If you can stick out, her tongue looks consistent and normal. Looking at her buccal mucosa, looks normal as well. Looking down her uvula, no inflammation noted. Could you call for me? Awesome. Alrighty. I'll be also looking at her skin turgor. It's elastic and full. Temperature is warm and dry, clean. Next, I'll be going to her neck. Symmetry is balanced and throughout. No inflammation noted. Thyroid and parathyroid. Alrighty. Next, I'll have you lay down for me, Miss T. I'll be listening to her jugular. If I hear any type of brute, could you hold your breath for me? Good, you can breathe. Hold your breath for me one more time. Great. No brute, auscultated. I'll be palpating to feel a thrill. No thrill, palpated. Jugular pulses are normal. All right. Next, I'll have you just sit right next. How'd you were, Miss T? Next, I'll be listening to Miss T's heart, or auscultating Miss T's heart. Aorta, pulmonary valve, Erb's point, mitral valve, and apical pulse. No regurgitation or anything abnormal noted or auscultated. Next, I'll be listening to her lungs posteriorly. Can I get a deep breath from you, please? Good. Another deep breath from me, in and out. Good. Another, please. Great. Another. Good. One last one. Good. Lung sound posteriorly sound clear throughout. I'll be also listening to her lungs anteriorly. You can breathe normal for me. Could you put your arms up and your legs Superwoman? Thank you. Lung sounds were auscultated and sound clear throughout. Next, I'll be moving to her abdomen. I'll first be auscultating her abdomen. And for the sake of privacy, I did not lift her shirt for the video, but her abdomen does look normal and nothing abnormal. Looks symmetrical. So does her breathing as well. Each section of the abdomen was auscultated, 2 minutes each. I do hear bowel sounds. Next, I'll be looking at her upper extremities. Could you raise your arms for me? Awesome. Can you put them straight out for me? Awesome. Can you put them to the side? Great. You can relax. Range of motion looks normal. Could you push me away? Good. Could you push me towards you? Great. All right. Could you also squeeze my fingers? Great. Muscle strength is normal. I'm going to listen or seeing her cap refill both fingers under 3 seconds. Feeling for her brachial pulses, her radial pulses, both consistent and normal, +2. Alrighty. Next, I'll be going to her lower extremities. Could you push up your legs for me? Good. Down. Thank you. Could you push up on your toes? Off my hands? Great. Could you push down like a foot pedal? Great. Muscle strength is consistent and strong for patient. Could you also kick up for me? Also with your left leg. Patient follows commands. Next, I'll be feeling your popliteal pulses. +2. Also feeling her pedal pulses. Also +2. Toes. Cap refill for toes is under 3 seconds as well. Going back to our abdomen, I also am going to palpate for anything abnormal for her liver. Feels normal, no inflammation. Her kidneys, also normal, no inflammation. Do you feel anything painful in your abdomen as I palpate?
No.
Alrighty. Patient states no, nothing feels abnormal after palpation. Abdominal reflexes, as I stated earlier, were normal. Alrighty. Overall muscle strength was normal throughout the physical assessment. Patient was alert and oriented the whole time, and also symmetrically balanced throughout her whole body of her lung fields, her body or her abdomen, and also her lower extremities and upper extremities. This will be the end of my video. Thank you very much to my patient here, Miss T, and have a good day.